Dr. Bharat Pankhania is a senior clinical lecturer at the University of Exeter and one of our regular go-to experts at the start of this pandemic. Dr. Pankhania, welcome back. So the WHO declares COVID no longer public health emergency of national concern. For those of us who don't speak WHO, what does that really mean?
So what that means is we know how to handle the SARS-CoV-2 virus and how to protect most people from infections and death. And what they're saying is we have the tools. We know how to manage it. We know what the vaccines can do. We know how to reformulate the vaccines if the virus mutates. So they're saying we know how to handle it, and therefore we don't want to put it under the emergency status that it was under.
So a bit like, I don't know, chicken pox or seasonal flu or mumps, it's just part of all of our lives.
Indeed, although whilst it is part of our lives, we mustn't, as the WHO report says, drop our guard and say, oh, it's only just like flu. It isn't just like flu. The reason why you, me, and many people are now okay and we're traveling around the world is either we've been immunized or we've had an infection and now we've got immunity. And we also have medications. We also have extra knowledge about people who need respiratory support, etc. So it's all those things put together that put us in a good place. It is not that the SARS-CoV-2 virus has become less disease-causing. It is just that we know how to handle it.
The debates, of course, rage on around the world on wearing masks and the use of lockdown. What were the biggest mistakes when it came to handling COVID?
So I think one of the biggest mistakes which we made earlier on is to assume that this was only heavy droplet spread. So you will remember we talked a lot, and we still talk about keep your distance and all those glass shields, if you remember, right? Whereas what we should have really reconsidered is this could be like SARS-CoV-1, which arose in 2003, Guangdong province, China. It was aerosol spread, and we should have thought in the same lines that, you know what, this could be aerosol spread. So there was a long delay in finally admitting that SARS-CoV-2 was also aerosol spread. That was mistake number one. Of course, we made other mistakes, but then we did good things too. Like we invented the vaccines, and the vaccines work, and the vaccines saves lives. So whilst mistakes were made, we also did great things.
After this terrible experience, has the world learned anything from this pandemic? Will we be better prepared next time?
So again, these are pluses and minuses. The lessons learned are we need a WHO type organization, and we need all the nations of the world, not only the Western countries, all the nations, China, Singapore, America, European Union, United Kingdom, to work together to develop better vaccines, better therapeutics, and have a coordinated worldwide effort rather than acting only in solitary, unitary manner. We work, and we work together is a better way.
Dr. Bharat Pankhania, thank you very much indeed for coming on the programme. Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter.